Let's talk about neophobia versus picky eating versus a pediatric feeding disorder. Neophobia literally means fear of new foods. This is a very typical part of childhood. This is when we typically see kids start to have more preferences, a little bit more selective about the foods that they're eating. This is a very normal process. A lot of times this is associated with picky eating. Now, picky eating in the research has a lot of varying definitions, but there are some criteria that we look at to help distinguish it from a pediatric feeding disorder. So we can look at picky eating as a child who's unwilling to try new foods. Typically, these children are so selective that they're all eating less than 30 foods altogether. Rejection of certain flavors or textures, especially vegetables, tend to have really lengthy meal times. And when presented with a new food or encouraged to try a new food, there tends to be a lot more struggle, or they get more upset than their peers. Sometimes they'll also get special meals served, depending on the context. Now, when this becomes a pediatric feeding disorder, or sometimes in early literature, what's called problematic feeding, the pickiness becomes much more selective and restrictive. Now, a pediatric feeding disorder has 4 main domains: medical, nutritional, psychosocial, and feeding skill. When we see a pediatric feeding disorder, we typically see more than one of those domains affected, but if at least one of them is affected, it could be a pediatric feeding disorder. Now, it also could be ARFID, depending on which domains are affected, and ARFID's avoidant restrictive food intake disorder. Is it just psychosocial and nutritional, or do we have an overlap there where we can have a pediatric feeding disorder and ARFID? However, the first step to differential diagnosis between these 3 is being aware of what typical development shows us. And so if a child is showing characteristics of neophobia or picky eating, we have to be careful not to over pathologize. With that being said, if a caregiver is ever concerned about their child's feeding, they're feeling any stress, any anxiety about what is going on, when in doubt, refer out. Seeking out a feeding evaluation can help determine what level of support a family or child needs, and hopefully alleviate some of that stress and anxiety around meal times, which could potentially take something developmentally normal and make it more complicated. Check out the caption for more.